Great. Pleasant afternoon to everyone, and thank you for joining us this afternoon for this week's Society Talk, in which we're looking at the plight of minors and their families and the challenges that they have been experiencing to access their old Social Security and compensation benefits. So before we get into the discussion, I'll just provide a very brief background which we're going to discuss in this session. So firstly is that the South African mining industry has historically attracted a large workforce from within South Africa, but also from neighboring countries, including Eswatini, Lesotho, Botswana, and Zimbabwe. And for most of the migrant laborers that were coming into South Africa, they came under specific bilateral labor agreements. And the context in which the laborers were coming into South Africa was very challenging at the time, and politically as well. And certain administrative procedures that they had to be completed, the recruitment process was challenging, and that has led over the years to the significant accumulation of unclaimed benefits. So when we talk about these social protection benefits, what are they? So we have compensation benefits. These benefits are held in compensation funds. I'll talk about quickly about the multiple funds where these compensation and social security benefits are being held. So we have the compensation fund, which where minors that may have contracted particular specific occupational disease can apply, or if they are eligible for a claim from the specific compensation funds. And we have specific legislation that governs the eligibility of these minors. So we have the compensation for occupational injury and disease act, which is the COIDA. Then we have the occupational disease for mine workers act, which is called the ODIMWA. And miners that have worked in the South African mines are able to process their claims through these compensation funds based on these acts. Then we have the provident, pensions, and retirement benefits. These are held in specific funds as well. In South Africa, we have the Mine Workers Provident Fund, we have the 1970 Mines Unclaimed Fund, and then we also have the Sentinel Retirement Fund. Then the other set of benefits are relief funds, which come based on specific litigation that could have taken place. For example, we have the Asbestos Relief Trust for miners that could have worked in that specific mining industry. So in this discussion, we are also going to, apart from looking at the current compensation and social security benefits, we'll also touch on a recent landmark settlement, which is related to miners that had contracted silicosis, and what these benefits and how miners are eligible to access them. And then we'll also be discussing, apart from that, in terms of what have been the challenges for mine workers, for the families to really access these benefits. We have a legacy of at least 1.2 million ex-mine workers in Southern Africa. And in terms of the amounts of money that is estimated to still not be claimed by miners, in relation to social security benefits, it's about 10 billion rands. This is based on research that has been done by the Southern Africa Trust and more recently by Health Focus, really confirming that there is more than 10 billion rands that is still owed to mine workers. But also in relation to compensation benefits, for example, under the ODIMWA, which I mentioned earlier, which has to do with occupational disease for mine work under the Mine Workers Act, there are about 600,000 miners that are covered there. But out of that 600,000, the claims that have been made for about 103,000 claims, there is about 1.2 billion that is owed to mine workers. So we're going to discuss all these issues to say these monies are owed to these miners, but what has really been the challenge for miners to actually access these benefits? And it's answering those questions to say, why isn't the industry paying them? What remains the challenge? And now we are in this situation where we have the pandemic. How has this impacted mine workers to actually access those benefits? How has this impacted current miners who are working in the South African mining industry? And there are so many questions that need to be answered. And I'm joined by a very great panel that is going to help me really answer these questions to really understand, why aren't miners able to access these benefits and what interventions need to actually be made. So in the panel, we are joined by Karen Odendal from Health Focus. This is an organization that has been working and supporting mine workers, implementing initiatives, producing information for miners to be able to know the process of claiming for their benefits. Then we are also joined by Naledi Monnakgosi from the Botswana Labour Migrants Association, who is the new coordinator for the Botswana Labour Migrants Association, also working with mine workers and families and widows in Botswana and really helping them to address certain barriers in relation to the compensation benefits and social security benefits. Then we also have Vama Jele, who's the coordinator of the Southern Africa Miners Association, but also representing the Swaziland Migrant Mine Workers Association. The Southern African Miners Association is a regional platform that has been advocating for mine workers and helping them to really complete administrative procedures, help miners to understand the process and their rights to claim for their benefits. At the same time, the association has also been implementing community initiatives to facilitate income generating activities for miners to really help them and support their families. And finally, we're also joined by Kitso Phiri, who recently was the coordinator for Botswana Labour Migrants Association, but now he's ventured into new work, but still supporting miners. And he's human rights, he's working in the field of human rights and in relation to the mining sector. So thank you so much to the panelists for joining us. And this is going to be a very interesting discussion. I think I have a panel that is full of energy, and we're looking forward to engaging with the stakeholders that have joined us. Please send your questions to our communication email, which is comms@southernafricatrust.org or comms@southernafricatrust.org. Or you can also send your comments or questions on the YouTube chat that is available, and we'll be able to get those questions, and the panelists will be able to help us to answer those questions. So let's get going, and I'm gonna start with Kitso. So I've provided a very brief background to say what has been the challenge without going so much into detail, the context of the South African mining industry, the plight of miners, the amount of money that is still held in the multiple funds in the South African, in South Africa, and what is really the challenge, why miners can't access these funds. What is the problem? Kitso.
No, thank you very much, Christabel, for that succinct introduction. I think you beautifully laid, the context that forms I think the discussion, or at least the significant aspect of the discussion that we'll be undertaking today. Now, to go into the issues, I think there are quite a number of issues that make it impossible for mine workers, and especially those coming from labor-sending countries, in accessing their social security benefits. And there are quite a number of challenges, but I'll try to, disaggregate or sort of separate, the challenges into two areas. One, that the challenges that speak specifically or directly to an ex-miner. Now, these challenges include one, advent of technology. A lot of the pension funds have migrated from, the old way of doing things, the manual system, and they have now migrated to conducting most of their businesses online. Now, technology is it's an area that a lot of mine workers are not familiar with, including the miners associations as well. And especially now with COVID, which I believe we'll get into it later, COVID has really expedited the use of technology, such that whenever a miner applies for or tries to pursue their claims, they'll be required either to use, the internet, to use websites, and etc. And the demographic that we are talking about is, a demographic that is in the twilight years of, the twilight, stages of their years. So advent of technology is a challenge. Low literacy levels. We are talking about people who are not formally trained, whose level of understanding, the complexities that come with navigating the social security space, and even, just understanding the administrative processes that, are normally, that normally entail, pursuing claims. I think the complexities of those processes make it difficult for miners to access their benefits. Government's inefficiency in supporting and pursuing these cross-border claimants. I think a lot of the miners would usually complain that, through the embassies and even, the ministries of labor, in their countries, in the countries of origin where these mine workers are from, most of these ministries do not even have capacity or even a level of understanding how, to access these processes. Lack of resources. Mine workers, because they're no longer gainfully employed, they're unable to travel, across the border, to go and access these claims. We can look also at invalidity of documents. We've noted that through the work that we've been doing, even when I was still at Bolama, you find that the data, member data, the data that is currently being used by these provident funds is inadequate. It's not enough. At times, the funds themselves, do not actually have the data with them so as to allow, enable a mine worker, to determine whether or not they have any unclaimed benefits sitting in that particular fund. And another challenge is the actual member, not knowing whether they have or they are entitled to benefits in that particular fund. And lastly, because a member may be a migrant worker, the systems that regulate, social security in South Africa, since we are talking about migrant mine workers who are applying their trade in South Africa, the compensation system is the regulatory system is quite foreign to most of these mine workers, and even the applicable laws that regulate the social security institutions are quite different from those that would apply or generally apply in the country where the mine worker is from. So those are some of the challenges that make it difficult for mine workers to access these social security benefits.
Thank you, Kitso, for such a good introduction to the key challenges that miners are actually facing. I think you've raised some key issues that I would actually ask Karen as she begins to share from the perspective of the social protection and compensation funds. I think you've raised some key issues around the knowledge material, access to information, and access to information is at various levels. It's access to information as the miner himself, whether he knows that I actually have benefits in a specific fund. And it goes back to some of the historical issues that I had raised earlier in terms of how the recruitment was done, and that information was never given to the mine workers to say a certain amount is going to a specific social security fund, and when you leave employment, this is what you are entitled to. So the aspect of information is so key. And also in terms of the documents that the miners have, and to help them complete and be able to meet the eligibility criteria. There's a lot of investment and work that needs to go into that. But I would like to move on now to Karen. And from your experience, I know Health Focus has been implementing a project that has been helping to address some of the challenges that miners are facing. What from the experience of implementing this project, and from the perspectives of the social protection and compensation fund, why aren't they paying these mine workers? So we've heard, I think, from Kitso sharing from the miners' perspective in relation to resources, knowledge, and information, but from the perspective of the compensation and social security funds, what is their challenge?
Thanks very much, Christabel. I just want to take it back one step with regards to, there are so many different compensation funds that you have mentioned, such as Sentinel in the 1970s. And I think a lot of the mine workers and ex-mine workers were, their money was being invested all over the place, and there wasn't a consolidated database that was tracking all the ex-mine workers. So the project that Health Focus South Africa worked on was in collaboration with, we were contracted by Southern African Trust, and we developed an integrated database and case management system. And this was for the South African government and compensation systems to assist in tracking and tracing and keeping the contact details, as well as being able to effectively manage the members in South Africa, as well as in the surrounding countries, to locate and pay out the benefits. We worked with the Minerals Resource Councils and Compensation Commissioner, and we had a very close relationship with the Medical Bureau for Occupational Diseases. As Kitso mentioned, as well as yourself, in terms of working with the ex-miner workers populations, they are migratory in nature. So it's very, very difficult to track and trace. They also aren't aware of the funds that have been saved for them. Based on the information that we did receive in terms of why payments weren't being made, is that there are a lot of documents that need to be supplied, and a lot of it is duplication. So when someone provides one document, they end up getting sent back to provide more. A lot of other people also encountered the difficulty with, there were staff strikes last year at the MBOD for quite a few months, which meant that payments weren't being made. Multiple unclaimed benefits also has proven to be a lot more difficult to track and trace and update the database to get all the necessary details. Examples are lack of addresses and contact details. Single unclaimed benefits seems to be a lot easier to pay out as opposed to the multiple ones. So I guess the difficulty is the lack of completed documentation currently. It's also a very lengthy process. So the social security and compensation funds also seem to be taking very, very long in order to pay out the people that need it.
Thank you so much, Karen. I think you've raised some very pertinent issues in terms of actually moving forward after this dialogue, things that we can continue to engage in supporting efforts of unlocking these benefits. I think one of the biggest challenges which you've raised is how miners would relocate and move from one region to another, and the addresses that they were using. Some of them decided to stay in South Africa, change their documents. So they're looking for people who are in Lesotho, but they're actually in South Africa. And obviously there are issues around identities and the years that when they were being recruited, the years that were allocated to them, which is different from what's on their ID. And I think the discussion needs to actually move towards saying, if all these issues remain unresolved, would they be a decision of changing the legislation to say that certain aspects that are required in terms of the criteria, there could be some exemptions so that minors could actually access these benefits. And these are some of the discussions that we need to have. So we've talked about two processes here and two main issues. Firstly was the challenges of minors to actually access, why aren't they able to access these benefits? Secondly, we've looked at the perspectives from the funds themselves. What are the challenges that they are experiencing to actually pay these out? But we would like to hear in terms of the minors themselves, what has this meant to them that they're not able to access these benefits? And what has this meant to their livelihoods? And I would like to really bring in Naledi to really share, to say, what are the challenges that minors are facing because they're not able to access these benefits? What is happening to the dependents, to the widows, and to the families? I would like you to just give us that picture in terms of what are the challenges that they're experiencing. Naledi?
Thank you, Chris. Good morning, team. Unfortunately, there's something wrong with my camera, so I can't. You can't see me. But actually, Chris, I'm not the new coordinator. I actually have the acting coordinator here, so I'm the board secretary. So anyway, the minors have got a lot of challenges. They tell us daily that they need to access their social benefits. They need to buy food, to eat healthy food, because they have challenges. Most of them are elderly and sickly, and they are poverty stricken. So they need their benefits to buy healthy food. They need to assist their families. They need to build houses. They need to buy livestock. Because they are sickly and elderly, they can't be employed anyway. So that is the big challenge that they are facing. And they're not getting any help anywhere. They're not accessing their benefits. It also falls to the children, because the children are also suffering. Remember, some of these people died a long time ago. Their children didn't have a proper upbringing of a mother and a father. They were raised by their mothers alone. And the mothers themselves don't have anything. They don't have the education. They don't have the skills. They don't have qualifications for anything. So they're actually depending on dryland farming. And as you know, nowadays, rains are very, very erratic. Like here in Botswana, there was virtually a drought last year. So these people, they don't have anywhere to work. They're only working on what they call e-pay. It's just a bit that pays them as little as 500 rands a month. So the children of the ex-miners are actually suffering. And then it comes to the widows themselves. The widows, as you know, they've lost their husband, so it has affected them emotionally. They have to raise the children alone. Themselves too, they don't have any qualifications, they don't have any education. Most of them didn't get any assistance from their in-laws. In fact, some of them tell us that their in-laws were actually pestering them. They were trying to deny them the little benefits that they should inherit from their husband's estates, like land and livestock. So the women are the ones who are suffering. Here in Botswana, we have a problem of youth unemployment, like everywhere else. So the youth, the children of the ex-miners are not working. So because they don't have skills, and some of them don't have proper qualifications, they are suffering. They don't have any means of living. So this is the problems that our people here are facing: the minors, the ex-miners, the widows, and the children. Thank you.
Thank you so much, Naledi, for sharing that, because that is the main purpose of why we are actually having this discussion, is to say there are people that are suffering, not being able to access these benefits, the children, the widows, and the minors that are still alive, and some of them that are sickly, that are not able to undertake any other income generating activities, and they need these funds. And how do we work together as different stakeholders to ensure that that the minors are able to access this benefit? And at this point, I'll bring in Vama to just share with us from the perspective of the Southern African Miners Association, how are you positioning yourselves as a platform to be able to respond to these issues? How are you profiling the challenges that these miners, the families, the widows, you know, are experiencing, so that the funds are able to respond? What needs to be done, and how are we positioning ourselves to profile the challenges of the miners and the families? Mama? I think your mic is on mute, Vama.
Thank you, Christabel, and the rest of everyone who is joining us on YouTube. And good afternoon. I will actually talk on the basis of Southern Africa Miners Association, which is a regional structure for the National Miners Association in the 8 countries of the SADC region. And what is so important that today we are actually talking about these challenges in addressing accessing compensations and as well as unclaimed benefits. We will note that what Christabel has said when he was opening this session, it talks about unclaimed benefits and as well as the compensations. And it lies in different ports and also in private sector and as well as at the government hands, which is the public and private sector. And as SAMA, we have established structures among the 8 countries where we have got miners associations, which are there to actually facilitate and also advocate and as well as socially mobilize mining communities, miners, and as well as their dependents to stand up and claim benefits, whether it's compensation or social security. And the second part of it is that these countries, maybe to mention them, it's Botswana, Eswatini, Lesotho, Malawi, Mozambique, Namibia, Zimbabwe, and South Africa, where we have these structures of miners associations. So we also have the second area is on the area of strengthening advocacy. Strengthening advocacy at the policy level, where we are actually advocating for political commitment, and as well as trying to shape the policies in a way that it can unlock the compensations, unlock the unclaimed benefits or the social security funds. And there are a couple of these policies that we worked on, and even though some of them have not been actually been implemented, but there are a couple of them. I will actually mention the main one, which is the SADC instrument on a portability of its SADC instrument of accrued portability of social security in the region, which is one of the instruments that will also facilitate unlocking of social security benefits. And then the third area is the area of database. As you have mentioned, Kitso have mentioned the issue of database. Karin has mentioned the issue of database. The database issue is a challenge. I won't talk about the challenges that Kitso and Karin has just mentioned, but we have seen that even though that we can actually have these databases, we will find that most of the time people keep on changing cell phones and as well changing location, as Karin have said, that's mobile population, which also it's one of the challenges that we face. But using the structures of miners and ex-mine workers and their dependents in the communities, it works very easy for them to actually locate even most of these miners or the beneficiaries of these funds. Then the fourth one is the area of partnership, which is very crucial. Sama has established partnerships with different funds. This included the Mine Workers Provident Fund, the Compensation Commissioner for Occupational Mutual 1970 under the Alexander Forbes, and as well as the Sentinel, and also the Ministry of Labor, which is the Compensation Fund. But even though this partnership has been happening, but there is still some other barriers that have a challenge for these beneficiaries to able to access these funds. And then the sixth one that we are looking at is the issue around the increase that we are seeing. There is an increase of people that are dying without getting their compensation, talking about the occupational lung diseases, because most of these miners who return home in the migrant states or in the countries of origin, we find that most of them have got occupational lung diseases, and are likely actually to suffer for a very long time before they can even actually pass on. So as SAMA, we are also working around the clock to ensure that there is medical services provision for the injured mine workers, which have got a very long-term social insurance with the Rand Mutual. And the second one is the biannual medical benefit examination, which SAMA also advocate through the national associations, that those miners go to these medical occupational health services to actually do the benefit medical examination is done by each and every 2 years. But because of then, the last area that I can talk about is accessing especially compensation and unclaimed benefits in the time of COVID, which is a very, very strange time where we have been used to face-to-face meeting with our clients. And today we cannot meet these clients face-to-face. And then we are using technology in order to access them, which becomes a very hard area because we haven't done this for a long time. It has always been face-to-face. So there is this kind of advocacy and social mobilization where we are looking at stepping up services in the national associations in order to ensure that they are able to help these beneficiaries or the miners and the dependents during the time of COVID-19. And this includes compensations and as well as social security. In a nutshell, Christabel, I'm sure that the last area is the issue of gender barriers, that most of the women in the region have a very serious challenges to access social security and as well as compensation for injuries and as well as for diseases. One, on the area of social security, there is this uprising of family disputes, which at the end of the day, the widow is actually chased out from the family home back to where she was born. And then the children suffer the consequences of that nature. Then the second one, it's on the area of compensation for occupational lung diseases, where Karin talked about many paperwork that has to be submitted and even duplication of this paperwork. And the compensation fund, even though it has been established long time ago, they don't even know the turnaround time of paying a compensation claim for one person, whether it's a second degree silicosis, whether it's a first degree, whether it's a TB, it's just the same thing. It takes very long before the client can actually get the money. So the widows has to comply with another set of regulations, which makes them not able to access the benefits, especially because they have to have the letter from master. The master has to bring the family, and the family also want a share. The widow has to pay more money, And again, you'll find that they get only 500,000 rands. But the last one, it's on a survivor's benefit, where an injured mine worker came back and get the disability pension. And then after that, he passes on, leaving behind a young widow with about 3 children. And during that period, because of the region, even in this region, we have this capacity area, that capacity challenges that Kitso actually mentioned, that even the Miners Association has got a capacity issue, where you'll find that the countries do not have an occupational health practitioner who can actually give a letter for autopsy to state whether the miner who has passed on is his passing linked to the injury during the cause of death. And most of all of them in the region are dying without having that letter. It doesn't mean that you die in your country of origin or you die while you are still in South Africa, but still the letter cannot be afforded. And then maybe I can close with the COVID-19 story, which affects us in the region. And the miners has to go for medical examination, but unfortunately, they can partially do it because they cannot not do the lung function test because of the COVID-19 issue. So we have got a very serious problem because that denies the miners the access to get money from the Tiamiso Trust beside the COD. So in a nutshell, even though SAMA has come up with a number of intervention and from policy, structure, database, research, partnerships, still we remain with a challenge because at the end of the day, SAMA and its affiliate are not in the decision-making level, especially in the different funds in the region or in South Africa. So our voice has been suppressed because the decision makers are not part of us, or we are not part of them. So that's how I actually, we have already done for the region in Southern Africa Miners Association. I thank you.
Thank you so much, Vama, for sharing. This is an area that I'm really passionate about because at the center of all this is a miner, his family, and them not being able to access these resources, which would make a huge difference in their lives. They have worked for so many years, some 10, 15 years, 20 years in the South African mining industry, but have been unable to access the benefits that are due to them, which would mean them having an education for their families, them able to meet some of their needs with regards to accessing healthcare, and also ensuring that they're able to invest in some income generating activities to support the families, because most of them are not able to get jobs in other sectors. But we've raised some very key issues, which I think beyond this dialogue is areas that we need to continue to engage. One is really looking around the reviewing of the current legislation, whereby there's conversations that move to the Treasury within South Africa to say, can we look at this act and discuss with the funds to say, if these people are never found, what happens to these resources? So we are talking about significant amounts of money. So when you talk about the 1970s Mines Unclaimed Fund, it has about 623 million rands that is owed to miners. In some of the work that SAMA has done in Malawi, in different countries, and your interaction with different miners, there are so many families that are desperate to have these resources. And I think conversations need to move to where we say what changes can be made. The issues around information and dissemination, that needs to continue to happen. The tracing, has to be more coordinated with the different funds, because one fund can attend to one miner, but the same miner needs to go to compensation fund, needs to go to Sentinel, needs to go to different funds. So what level of coordination needs to happen? And having a coordinated database, I think there have been efforts to move towards that, but funds are not willing to come together, to work together around that. The partnership is important. Issues to do with bank accounts that miners need to open, and ensuring that they have exemptions from things to do with tax, and money that has to go outside the country. So there are all those issues. But I think another issue raised is that we're in this pandemic and there's need for using various technologies. How do we begin to equip ourselves, as associations, as different entities working in this space? How do we ensure that we're able to help the miners in this context and that they're still able to get their benefits? So we've talked about the social security and compensation benefits. Quickly, I would like to have a quick discussion around the recent landmark settlement of silicosis. And this is another amount of money, 5 billion, that has been allocated to the Shiamiso Trust to help the miners that had contracted silicosis. I would like to, just as an opportunity to share information, Kitso, can you briefly share with us, who is eligible to access these funds, and which categories, and how would they go about accessing these funds? Mm-hmm. And we've already talked about the challenges that miners are already experiencing with regards to the current compensation and social security funds. What do we need to prepare for? But firstly, just give me an overview in terms of, what came out of this settlement and who is eligible to access these funds.
Yes. No, thank you very much, Christabel. So on the in July of 2019, a landmark settlement was confirmed at the Gauteng, at the South African High Court, the Gauteng High Court, on the 26th of July in 2019. And this landmark settlement was a settlement that was concluded between the claimants' lawyers, meaning the lawyers, those who were representing the mine workers, and 6 mining companies. Now, one of the outcomes of that settlement was the 5 billion, that was awarded as damages to compensate mine workers who had contracted silicosis and work-related TB. And the effect of that was that, as a result, the money, or one of the terms of the order, was the establishment of a trust, which was named or called Tsiamiso, meaning to make good, Tsiamiso. And Tsiamiso Trust would act as a vehicle through which miners would be getting or be receiving that compensation, and specifically those who had worked in the gold mining or in gold mines, the 6 gold mining companies that were party to the settlement, and those who met the following criteria. One, they had to have worked in a gold mine, and specifically a qualifying mine. Qualifying mine meaning one of the 6 mining companies that were part of the settlement. And then 2, they needed to have worked or carried out what we call risk work, either worked underground or worked on the surface, but doing risk work in terms of the Odemwa, and working during the qualifying period. The qualifying period means any time between the 12th of March 1965 and the 10th of December 2019, when the settlement was concluded. So that is called the qualifying period. And the mine worker should have, within that period, contracted silicosis or work-related TB. Alternatively, the dependents of a gold mine worker who has passed on as a result of contracting TB or silicosis within the qualifying period. Now, there are different classes of compensation, but perhaps before I get to the different classes, indicate that the trust will run for 12 years, meaning that from the 10th of December 2019, and it'll run for about 12 years. I don't know when the 12th year would be, but yeah, it will run for 12 years, and then the 13th year would be the year where the trust would be wound up. Now, there are 10 classes of claimants or eligible, classes of claimants or eligible, or rather 10 eligibility classes or classes for eligibility for compensation under the trust deed. And the amount of compensation that is paid ranges from 70,000 to half a million. And there's class 1, which is around 70,000, which is silicosis class 1, 70,000. Silicosis class 2, which is around 150,000. Class 3 of the silicosis compensation class, the compensation amount goes up to 250. And then there's class 4, which is, for special and aggravated medical conditions. There's a special award where claimants would get, a maximum of about 500,000. Now, in addition to that, there is now the TB class, which ranges from 50,000, which is class 1, class 2, 100,000, and you have what we call historical tuberculosis, which would attract a compensation amount of about 10,000. And with historical tuberculosis, what is required? One of the requirements is that one, in the absence of a medical report, where a mine worker does not have a medical report to determine, the degree of the tuberculosis, then the eligible claimant would be required to show proof that one, they worked for a qualifying mine for about 2 years. Qualifying mine meaning one of the 6 mines that were party to the settlement. And number 2, they should have worked between the 12th of March 1965 to the 28th of February 1994. And they should have been either issued with a certificate, or if they don't have a certificate, they should just show any medical record that shows that indeed they contracted tuberculosis within that period. And they'll be eligible to compensation of award of about 10,000. So there are different degrees. This would, it will require me more time to just fully unpack, the different requirements, but that's just a sort of like a high level overview of the different compensation classes and eligibility classes that a mine worker who is contracted tuberculosis would be eligible to or for under the TB silicosis, under the TMSO trust rather. Yeah, thank you very much.
Thank you so much, Kitso, for sharing. I think we'll need another session just to focus on the silicosis, because some of the challenges that we've talked about are going to be encountered when it comes to miners trying to process claims under this. Because if you look at the eligibility criteria for silicosis, so many documents need to be submitted. And you're looking at miners that some of them do not have the skills or information around these areas, and they'll need a lot of support. So maybe in another platform, we'll be able to just go into detail with regards to the trust and how it's going to function and how different stakeholders need to come together to work to help miners really access these funds. Because if the 12-year period lapses and miners have not been able to claim for this silicosis funds, I think that would be the end of it. So I think we need to find ways to work together. And I think there are initiatives that are trying to push, like the Justice for Minors Forum that most of us on this platform are engaged in, trying to really profile the issues to say these monies need to start getting paid. But we have also the COVID pandemic, and how are we going to tackle that with the use of technology? There's some comments that have been coming up and say what kind of technologies are required or needed to help minors, so that you have less contact with the minors, but you're able to get all the relevant information. I think it's different funds working together to say what database can we come up with and what kind of technology could feed information in that specific database. So there's a lot of work and investment of resources that is required. We're almost coming towards the end of our discussion, and I would really like to go to all the panelists to really just start giving some of their closing thoughts in terms of what needs to be done. So I'll start with Naledi, then go to Karen. Naledi, what needs to be done now? You are always interacting with the minors, the families, the widows. What do they need now, and how do we help them?
Honestly, Christabel, I'm unable to answer that question. But what I can tell you is that the minors need assistance. But they need their money, full stop. That's what they need. They don't want, they need assistance from government. They need assistance from maybe donors. But at the end of the day, they need to get their money. Right now, as I was just saying, this due to the ongoing lockdown and movement restrictions, the minors diagnosed with silicosis and TB can't even access public health facilities for checkups. And it's a virtual lockdown here in Botswana. There's not even a taxi, a kumbi. There's no public transport. Nobody's assisting them to access maybe their TB medications. So basically, what needs to be done is just to assist them, maybe to start income generating projects. Like we're starting with the widows here. We're assisting them to go into crafts and arts and maybe small projects like poultry and fishing, which they do in their fields, because they do have land, but there's no rain. We are able to assist them with small ponds to start their fishing projects, to start poultry projects. The women are the ones who are suffering basically because they have to look after the children. So what we're trying to assist them is with trying to get income or to start income generating projects for them. Thank you.
Great, thank you so much. I think I like where you started from, that they need their money. And I think that's the bottom line. And how do we get them their money? So Karen, what needs to be done among the different stakeholders in order for us to move towards addressing these challenges? Because we need to be looking at solutions in the context of the pandemic. What can we do and what needs to be done? Mm-hmm.
Well, I think the main focus would need to be streamlining processes. I mean, we need to have a database where everyone, all the different compensation funds and that can feed the information into it. There also needs to stop with the duplications of documents. I think provide one document and that should be suffice. Obviously, there are a number of documents that need to be submitted. And I guess now with COVID, it's difficult to also track and trace and find these people. I mean, we're still worrying about their health as it is being sick with TB and all of that. But now we've got COVID to worry about. So there's a lot of challenges, I think, facing the ex-mine workers now in terms of claiming their benefits. And I guess we've just got to try and make a plan, use technologies, and streamline processes as best we can.
Thank you so much. Kitso, any last remarks from you in terms of what needs to be done? And then I'll wrap up with Vama.
Yeah, I think for me, the biggest challenge, and this is something that I alluded to initially when I began my presentation, is the issue of the regulatory framework. The regulatory framework is such that, the one that is applicable, especially the one that is relevant to us, obtains in South Africa as a legal framework or regulatory framework that applies in South Africa. And it's different in Botswana, it's different in Zambia, it's different. So the issue is for us to harmonize. Why can't we just have one framework where one framework that would allow portability of these social security benefits, a framework that will make it easier for a worker who was working in South Africa, as soon as they return home, for it to be easier for the money to follow them back home. Currently, that process is not very clear. Even if you engage government, they're not very clear on what process and protocols to follow. Nobody really knows who's doing what, when, and how that process is supposed to unfold. So all I'm saying is, let us make one regulatory framework that will make it easier for whoever's benefits in whatever country that they work for to follow them when they return back home. It's as simple as that. So one framework, one policy or legal document that would make facilitation of access to these benefits from one country to another simple. Yeah.
Great, thank you so much, Kitso. Vama, what are your last thoughts?
Thank you, Christabel and colleagues. Yeah, on the side of Southern Africa Miners Association, we just giving a thought on engaging all stakeholders or all role players, that is governments, social security funds, compensation funds, and as well as the different trust funds like Tiamiso Trust, Kubega, ART, KRT, and also the beneficiary funds, which are actually holding monies for the minor children. And the second one is to strengthen the partnerships. We have seen partnerships working, especially with the Mine Workers Provident Fund. The 1970, although we started late, we have seen Sentinel coming forward in the ship. And then we also established what we used to call it the technical task team group that was involving the Ministry of Labor and also of the region, and also the Miners Association and other civil society institutions that works within the platform of mine workers. But even today, we can still use that platform using it virtually. And then the third one is to build the capacity, building capacity in the Miners Association. The capacity that I mean to build is on the issue of using online web-based solutions. And as well as promoting the use of the web-based of utilities, where a mine worker has got children that have been sent to school, and if they can be provided with a handset that can actually allow that Zoom or whatever links or the database claim system software, then it can be another way of trying to work within the area where there is lockdown and travel ban. And then the fourth one, it's on the issue of the beneficiary fund, which is the guardian funds. I want to stress a point that it is important that the countries where these migrants come from must actually provide to the social security funds beneficiary funds listed in those countries. So then whenever they do, the trustees do the allocation to the families, they can actually push those for the children to the country of origin. We've got a number of ex-mine workers' children who died in the mines, and their money has been taken to ABSA Trust, their heads, Living Hands, and then at Living Hands Fidentia case, you all know that they lost their money. But it's worth mentioning that if that was within their country of origin, it was going to be easy for the mine workers and easy for the country to see how they can bring solution to that. And just the last one, it's the fifth one, is continuously advocate and mobilize miners and dependents for assistance, especially within their family settings or within their community settings. Why I'm saying that? I'm saying this because all of our mine workers who are spread in this region are implementing the TB in the mining sector program. And they have community mobilizers out there in the community, and who recently trained them on COVID-19 prevention, and as well as TB and COVID-19, which puts them in a better position to say that we can utilize them to actually assist the miners at their own communities. And with those 5 points, I think they can take us somewhere where we can better off. I will also emphasize on one point that came out from Ms. Naledi, where he talks about economic empowerment in the time of COVID-19. You will know for sure that most of the mine workers, the ex-mine workers, most of them, they are employed as guardmen or security guards. And some of them, the widows, are washing clothes from their neighbors and as well in other urban areas. But currently, they cannot be in a position to do that. And the support that can come on income generating activities will be very crucial, not only for the widows, but it's also inclusive to the mine workers, because at this moment, most of them are experiencing an increase on mental health issues and as well as gender-based violence. It's actually one of the root causes that has been due to COVID-19, and the issue on unable to access the benefits and as well as compensation. I will close by saying that it's very important that food security issues are very challenging in the region. I thank you, Christabel.
Thank you so much. I think the last point that you raised is very important, that around food security and ensuring that miners and the families have access to food during this period, and the fact that they are not able to undertake any form of economic activity to support the families. We've come to the end of this session, but I would like to just end with just sharing some quick thoughts from what the different stakeholders have shared, importantly for helping us to take forward and what actions we're going to undertake following this conversation. Firstly, it's around, I think, building capacities of national association in relation to the use of technology. How can we better be responsive to the miners and the families, and to actually assist them during this period of the COVID pandemic? We have to continuously engage the multiple funds around coordinated tracing, around having a common database that we can work with. I think we need to push and engage and advocate within SADC with regards to the implementation of the portability framework, because that was the basis in which we could facilitate cross-border payments and cross-border transfers with regards to the benefits that are owed to mine workers. How is the implementation going there, and how do we continuously engage with SADC? I think another important area is around the gender barriers. And in the context of this pandemic, a lot of women could, and also vulnerable men could be excluded with regards to them being able to complete the multiple processes with regards to claims. How do we address the use of technology, but also ensure it has the gender bias? And then lastly is obviously to engage the different funds around some of the bureaucracies and administrative regulatory requirements which miners need to complete. How do we engage with them to streamline some of those processes? So I think there are a lot of issues, but we'll look forward to having a part 2 of this discussion and be able to go into more details on specific funds and to see how we can work together with the different stakeholders to address the challenges that miners and the families are facing, so that they could have their money and be able to improve their livelihoods. So thank you for everyone that was able to join us today, and we look forward to having another conversation on a different thematic area next week. Have a wonderful day, and thank you all.
Very much, Chris.